the introduction. I'm going to break this into a few different lectures. So let's get into the first one. This is going to be a, not really a summary, I would say an elaboration of what I spoke to you guys about earlier. Just kind of giving you a sense of what is the sociology of mental illness? What does that mean? What are we going to be talking about? So sociological approaches to mental illness regard mental health and mental illness, regard this as aspects of social circumstance. So sociologists care about the social conditions that influence mental health. So negative life events like failing a class or demanding social roles like being a student and an athlete and a daughter and a parent, levels of social support. Who do you have in your life? Who do you perceive to have in your support system? Who is built into your support system? So the differences of having a supportive best friend versus a caring advisor, for example, and culture. Sociologists also examine not just what the conditions that influence one's mental health, but the way that society defines and responds to mental health. So if we think of medicalization, for example, identifying, or I would say portraying non-medical problems as medical problems and then using drugs to treat them, identifying emotions as mental illnesses, that's a product of our current time. Centuries ago, they weren't using pharmaceuticals to treat feelings of sadness. And so we think about culture and circumstances, and these are the things that sociologists are interested in. So the sociological approach is distinct from bio and psych approaches, but also complementary too. So I mentioned in the welcome video that it's not that I'm saying sociology is better or is the only way that we should learn. What I'm telling you guys in this class is that the best way to understand mental illness is through a variety of fields. So sociology is distinct from others in that sociology focuses more on social circumstance and individual brain chemistry, but it's also complementary because brain chemistry matters. Childhood matters. Genetics matter, but having a sociological a sociological understanding also can help us comprehend mental health and mental illness better. So bio and psych tend to focus on the individual. So a lot of people think that our moods have to do with our personalities. Oh, she's just moody. She's just grumpy. She's cranky, And so if we think about therapy, oh, that's just a negative person. Therapy is about changing our state of mind and modifying our worldview. So psychologically, we can see that mental illness is treated like an individual worldview type of problem. Biologically, others think that it's our biology, our neurochemistry, our brain chemistry. And that's why we'll talk about people who are bipolar as having a chemical imbalance, for example. So whereas therapy, the psychological, is focused on reframing the way that individuals think, psychiatry is focused on prescribing medication to correct brain chemistry. And so typical approaches to mental health have emphasized the individual, changing the worldview, correcting the brain chemistry. Now, sociologists don't say get rid of medications, but sociologists say, well, let's look at the social as well. So sociologists focus on social circumstance. And this assumes that different individuals who are in the same circumstances will have similar mental health. And so regardless of your individual idiosyncrasies, if you are in the same exact social circumstance as somebody else, you are likely to have similar mental health to this person compared to somebody in totally different social circumstances. And so how we feel isn't just about our personalities or our brains, but also the conditions that we face in our social environment. So taxing living conditions, demanding social roles, unstable relationships are all related to lower levels of psychological well-being. So stressful events, persistent living conditions that are rooted in ongoing difficulties, these can impact our mental health. And these are things that sociologists are concerned with. So stressful events like unemployment, receiving a difficult medical diagnosis, a loved one dying, being the victim of crime, being a part of a natural disaster, being a part of military combat, surviving childhood abuse, living in poverty, living in an unstable neighborhood, dilapidating housing, broken families, a difficult marriage, an oppressive work environment, unreasonable parents. The more frequently these occur and the more serious they are, the worse your mental health is likely to be. And so a sociologist would say, yes, somebody who has a genetic history of depression might be more vulnerable, but also their circumstances. So whether they are in a safe environment, whether they have supportive parents, that's also going to impact their mental health. It's not just their brain chemistry, but their social environment as well. So it's these kind of events like unsafe neighborhoods, demanding social roles that sociologists are more concerned with, more than just individual brain chemistry. So social characteristics impact how we respond to emotional difficulties, why we respond, if at all, and if we respond at all. So gender, class, age, education, race, sexuality, citizenship, country of origin, all of these social characteristics impact how we're going to respond to emotional difficulties, whether we'll even perceive them as emotional difficulties. And so gender impacts how we perceive our emotions. Women are more encouraged to tap into their emotions. Men are more encouraged to direct stress outwards, for example. And so we'll talk about this, about gender, sexuality, class, race, education, how these impact our experiences with mental illness. Culture, the shared system of beliefs, values, meanings, language, culture is a huge influence on how we understand mental health. So emotion dysregulation, having irregular moods, frantic fears of abandonment, lack of emotional stability, having these kind of experiences, if you're in a culture that stigmatizes mental illness, you might be less likely to get help. You might be less likely to even admit that something is wrong. Maybe you'll be more likely to blame it on somebody else, rather than admit that there's something going on in you that's not quite right. And so sociologists care about social characteristics and also culture. Not only that, but it's not just how do you feel about getting treatment, but what does your environment say about getting treatment? Are you able to get treatment? So accessibility of healthcare and quality type of healthcare also influence psychological distress. So not just does your insurance cover therapy? But one, do you have insurance? And then two, what kind of therapy does it cover? Can you access it? Do you have to take 3 buses to get there, or is it down the street? So all of these are examples of social characteristics, context, circumstances, and culture that can influence your response to psychological distress. So what outcomes do sociologists study then? So non-sociological settings typically take place in clinical settings. A clinical setting is where somebody is because they've already been diagnosed. And so if you see a study done at a mental hospital, that's a clinical setting. It's a setting that is already, it's pre-established that people who are there have mental illnesses. So biological, psychological research typically studies schizophrenia, bipolar, depression, OCD in clinical settings, people who are already signed up for therapy, who are already enrolled in inpatient, outpatient programs. And they typically take the approach of you either have it or you don't. You're bipolar or you're not. You're schizophrenic or you're not. Sociology is different in 2 ways. One, sociological studies take place in the field. So sociological research would be more like observing children on a playground, looking at neighborhood statistics, interviewing families. So natural settings where a diagnosis isn't a pre-established necessity. And also the sociological approach to mental health isn't so black and white. It's more of a continuum approach. So we want to know how people classify, identify, define, respond to mental illness, not just the sufferers, but also people around them. So some examples of sociological studies, some researchers will interview people about attitudes towards mental health. You can analyze statistics of mental health treatment facilities and variations across marginalized groups. So are men more likely to experience depression? Are women more likely to be diagnosed with autism? And I'll tell you right now, both of those are actually, the answer is no. And we'll talk more about that this semester. And so that's one way of doing research, is analyzing across groups, comparing treatment across areas to see how the mental health system influences help-seeking behaviors. And so interestingly enough, far more people with mild psychiatric disturbances seek help in the US than in other countries. And so we do live in a culture that stigmatizes mental health, but keep in mind that it's much more encouraged here than it is in many places. So sociologists use general scales that measure well-being. We're not going to go over all of those scales. If you're interested in the scales, let me know. I'd be glad to include it, but it's not necessary for our purposes to dig into the scales. But general scales are used. Sociological research also relies on stats about rates of mental health. And these studies are good at showing broad social variation in the development and response to psychological problems. So sociological studies don't do a great job of saying much about the individual experiences. Sociology is about drawing social patterns. So biology will tell you about the individual. Psychology will tell you about the individual. Think of bio and psych as more micro, and sociology as more macro, in that we're identifying social patterns. However, again, I mentioned in the welcome video, I have a background in psychology. And we will be looking at the individual experience as well. So the readings on Canvas are all sociological studies. Your textbook, your textbook chapters are all first-person accounts of mental illness. And I genuinely believe that this is the best approach. So like I said, this is interdisciplinary. I'm not saying, screw bio and psych, socia's the way. What I'm saying is that by looking at bio and psych and soc, that's how we get the best understanding of mental health. So we'll be looking at social patterns, as well as infusing that with individual experiences told by people who have mental illnesses and caretakers of those with mental illnesses. Okay, see you in a second.